Good evening. My name is Keyshawn Goldmus, and I'm here to present on the subject, Hospice EHR Research and Recommendations. The central question that I wanted to answer with my research today was which EHR would best meet the functionality needs of Compassus, a nationwide hospice that's considering transitioning to an electronic health record. To answer that question, I evaluated three types of EHR softwares to determine which one would best meet the functionality needs of Compassus from an outpatient nurse's perspective in order to make a recommendation to the organization's stakeholders for purchase. Through the process, we interviewed three hospice software providers to obtain an understanding of their benefits for comparison purposes. I evaluated their features, of course the software features, the cost of the software's ability to image existing paper records and upload that information into the software, and also the functionality with existing programs such as Cerner, Comfortably Mileage, and Workday. The three software providers that I evaluated were ContinuLink, Healthcare First, and Kinzer. The independent and dependent variables that were affected or involved in the research include the following. The independent variables include the EHR functionality, which required features and benefits. Wanted to determine and ensure that the software could address the needs of the nursing staff, which included scheduling, the ability to bill notes with Medicare and CMS, and then also the form options. So there's a few other factors that were in place, but the form options were really important because we wanted to make sure that the software template actually provided the specific forms that we needed, such as certification of terminal illness and the 3074 required by CMS and so forth. Now, another independent variable was the outpatient nurse's perspective. And so it was really important to evaluate this component because the organization needs to have the hospice nurses buy-in in order for the implementation to be effective and successful. The other independent variable in terms of determining whether or not or which EHR we would select was costs. Of course, it needs to be affordable and within the budget constraints provided by our corporate department. Again, then there is the ability to upload the existing paper records, and of course, again, the technological compatibility with existing software devices such as Apple and Windows tablets. Because our nurses are currently documenting manually, we wanted to make sure that if they were to take an Apple tablet or an Apple device or a Windows tablet into the home of a patient, that they could actually with ease document their nursing assessments and plan of cares. And all of those independent variables impacted the dependent variable, basically, which was which hospice software would be selected to be recommended. Okay, we relied upon the technology acceptance model of relationships. And so the technology acceptance model basically says its use is dependent upon the hospice nurses or the user's perception towards the software's ease of use and its usefulness during the course of work. So if in order for this software to be recommended, of course the nurses would have to perceive the software or all of the other independent variables as useful. The ease of the use of the technology would be a huge factor in determining whether or not if the software could be implemented. So to determine and obtain feedback from the hospice nurses to answer our central question, we actually asked them 8 questions. And those sub-questions, I'll just read a few. They asked them, have you ever used an electronic health record? Because we wanted to determine whether or not if they had experience. And if so, what software was used, because we wanted to know, was it one of the 3 that we were evaluating? The next, what software features did they like, or did they like or did they dislike. So we wanted to know, what did you like most or least? And then we asked them to describe the types of features they'd like to the new Compassus EHR to include. Did they want it to have form options, to help them with maintaining their scheduling? So there's some different things that we wanted to know and these were all open-ended questions because we wanted to give the nurses the ability to kind of elaborate on their opinions and provide additional feedback. There's definitely, I'm certain, there were jewels that we found out, more information, questions that we didn't know to ask. We were able to get some of those answers just by giving them the option to elaborate. We asked them, if they prefer to use technology when documenting nursing assessments because we wanted to know what was their preference. Did they prefer to use an EHR or would they prefer to write their nursing assessments? Do they like the current system we have in place? And then we asked them on a scale of 1 to 10 how they would rate their acceptance of technology because that was a critical component. That question let us know what their perception was to technology in and of itself. How did they feel about using a laptop? What was their perception towards documenting on a tablet? Were they open to documenting via their cell phone or using an app? What was their familiarity with the use of technology? And then in what ways they believe that the use of that technology would make performing their job easier, because ultimately that's the goal. Of course, we want to become more efficient with our record keeping, but we also wanted to ensure that we were providing the nurses with the support that they needed to help improve the efficacy of their job functions. And then the last question we asked was, do they believe that the use of technology would improve their job performance? Because you got to get them to buy into the use of technology in order for it to be effective. Of course, if they didn't believe in it, then of course it'd be difficult to be successful at using it. And so that was one of the questions that we wanted to answer, just to kind of feel out what they thought. Now, of course, because the information was obtained for the purpose of providing a recommendation, we don't yet have any results back from Compassus because, of course, it takes time to evaluate this information. But these were the methods and the process that was used in order to perform the research. Please let me know if you have any questions. Thank you.